Now, clots can expand, and there is some positive feedback here. So, thrombin is bound to platelets and is trapped inside of the clot itself. Thrombin can then act on prothrombin to generate more thrombin. That's positive feedback. Thrombin can also produce more prothrombin activator. Therefore, the more fibrin monomers and polymers are generated, the more the clot will grow at the periphery. Here's a great summary slide. This is an excellent study tool. I would memorize and know all your factor numbers. I would only know the specific factor names for the ones that I'm identifying or underlying here, because these are the ones that are probably the most important to know. Okay, so these five names I would know are these five numbers, and then know where they're formed, especially if they're formed somewhere different, right? This is an inorganic ion. This is a glycoprotein. This is everything else is a plasma protein. And if there's a special location, most is liver, but we've got tissue cells, we've got plasma, we've got platelets, we've got lung capillaries, and we've got bone marrow. And then their function, what pathway are they a part of, and or what is their main goal. So if we looked at hemostasis, the key events, we have a severed vessel, our platelets agglutinate, fibrin starts to appear, the fibrin clot forms, and then we have clot retraction, which clot retraction is just another way of saying fibrinolysis or the breakdown of the clot. So once the clot is created, it has to be stabilized and then it has to get rid of, right? We have to get rid of it once the damage to the vessel is repaired. So clot retraction utilizes our muscle contraction fibers, actin and myosin in platelets. And these fibers are going to contract within platelets within about 20 to 60 minutes of clot formation. The contraction will pull on the fibrin strands and start to squeeze out serum from the clot, which serum is essentially plasma less the clotting proteins. This also helps to kind of sew or suture up the ruptured blood vessel edges together. During clot retraction, the vessel is healing. Platelet-derived growth factor, or PDGF, is released by platelets, which stimulates smooth muscle cell division and also stimulates fibroblasts to start rebuilding the vessel wall. And then we also have VEGF, vascular endothelial growth factor, which is going to stimulate endothelial cells to multiply and to restore the endothelial lining. When clots are removed, this happens once the repair is complete. It'll start within about 48 hours and it'll continue until the clot is dissolved, which could be up to several days. Plasminogen, which is a plasma protein that's trapped in the clot, will lead to plasmin. And plasmin is a fibrin digesting enzyme. It's a protease like trypsin. Tissue plasminogen activator, or TPA, or factor 12 and thrombin all can play a role in converting plasminogen to plasmin. Now, there's some limitations. The swift removal and dilution of clotting factors, the inhibition of activated clotting factors, thrombomodulin bound to the endothelium because that binds to thrombin. Thrombin and thrombomodulin will activate our protein C, which inactivates factors 5 and 8. And a limited amount of thrombin is restricted to the clot by fibrin threads, which prevents the clot from getting too big or by getting out onto the bloodstream. Antithrombin 3 inactivates any unbound thrombin that gets out of the clot. And heparin, that our basophils and mast cells can release, inhibits thrombin by enhancing antithrombin 3. And it removes essentially 9, 10, 11, and 12. Now, we want clotting to happen so that we can heal our blood vessels and stop bleeding. But we don't want clotting to occur in an undesirable effect so that we have microclots everywhere. So ways to prevent platelet adhesion is really keeping a smooth endothelium of the vessel. A glycocalyx or mucopolysaccharide coating repels platelets and clotting factors, and certain antithrombotic substances secreted by endothelial cells like nitric oxide and prostacyclin prevent clotting from occurring. And lastly, vitamin E quinone, which is formed when vitamin E reacts with oxygen, can also prevent platelets from adhering. We'll stop here. When we come back, we'll look at some pathology connection disorders involving clotting.